Thanks everyone for joining this afternoon. It's Friday. We've got a full house. I'm excited to be here and really excited that y'all are joining us. Like Lindsay said, if you have any questions, go ahead and throw those in the chat and we'll try and save a minute or two at the end to run through those. Today, we're going to be talking about automating your financial clearance process. And just to be clear, I kind of define financial clearance as anything related to patient financial counseling. That's your verification of insurance, your cost estimation, prior authorizations, and then communicating the financial responsibility to the patient. So we'll talk about kind of how that is approached today versus an automated way of performing your financial clearance process, and then what the benefits are for facilities. Again, my name is Chris Finelli, and I'm joined by my esteemed colleague, Chris Pompilio. He's one of our senior sales engineers. He's been with the company really since inception and worn a number of different hats with the company, so he's really an expert in just about everything related to ASCs. And he'll be walking us through the demo today. So on our agenda, we'll talk a little bit about the impact of automating your financial clearance process, repeatable steps to follow, and then, as mentioned, Chris will run us through a high-level overview of the actual software platform, and then, again, a minute or two at the end for Q&A. So what is the impact of automating your financial clearance process? I think first we really have to ask ourselves the question, how we deliver this financial clearance process without any of those time-consuming, manual, and repetitive tasks. So there are basically three approaches that we see today. Actually, it was four until probably recently, and I'll explain that here in a moment. But the first approach that we see is a very thorough and manual process. That means you have staff, typically more than one person, who's doing your insurance verification. They're gathering the patient's benefits, they're taking those benefits, and then they're applying the plan design to allowable amounts. They're looking at multi-procedure discounting rules, multi-tiered plans, things of that nature. And then they're calculating an estimate and going out and making phone calls to patients. I love that process, other than it being manual, because it means you realize the importance of financial clearance. And what we've seen in doing over $25 billion of estimates is that patient responsibility is about 25% of the total allowable, and that can have a significant impact on your financials at the facility. So the second approach isn't as thorough. Maybe you're going to a website or using Availity and then plugging the patient's benefits into your practice management software, coming up with an estimate, and then maybe calling the patient or texting them or figuring out a way to deliver that estimate to the patient pre-service. The third approach is just outsourcing and having someone else do it, whether it's a CBO or your billing company. I was working actually with a facility down in Texas. They were spending $12 per patient. Just absolutely crazy. I asked them why they were doing that, and they said, well, it's less expensive than us doing it internally, where it takes us 25-ish minutes per patient. So putting that all in perspective, that's why we say it's really important to be thorough and automated and doing it at a reasonable cost. There has to be a return on your investment for going through the process or for implementing a system that can help you do it in an automated fashion. So again, I briefly touched on these, but let's talk about the key steps when you're going through this process on your own, or whether or not a system like Clarity is doing it for you in an automated way. The first thing, again, is doing that eligibility and verification. In our approach, we do this at the time of scheduling, but typically, again, sites are going out to the various websites like Availity or to the individual payer sites, making phone calls. It takes a lot of time, right? You might be sitting on hold for 15 or 20 minutes while you're waiting for someone to pick up. The second step is taking that information and calculating the patient's responsibility based on what your allowable amounts are and plan design and multi-procedure discounting rules and everything like that. A lot of times it feels like you need a PhD in mathematics to come up with the correct number. The third step is authorization. Very, very important. it seems like we're always fighting denials. Say, oh, you didn't have a PA, which means we need to go out and get a retro auth. And that always seems to be for like the most expensive case that you've done in the past couple months. It's usually like a spine case or something where if you don't get it, you'll really feel the heat. So very important to do that. Step number 3. The fourth step is the patient communication. There's almost no point in determining patient responsibility if the patient doesn't know what their financial obligation is to the facility. So in a manual fashion, it typically means you're reaching out, patient looks at their phone, they don't know the number, they don't pick up, and it's very challenging to get in touch with that patient. Or if you do, they're in the car, they're driving, they got 2 screaming kids in the back, and it's not the right time to have that call. And then, of course, what is very important is being able to collect from the patient if they understand their financial responsibility, what it is they owe and why they owe it, they're much more prone to pay it. So the HST approach and automating this entire process means that we're doing eligibility polls at the time of scheduling, the first day of every month, 2 days prior to the day of service, and this takes seconds, not 10 or 15 minutes. We have the most powerful calculation engine and algorithm engine on the planet for ASC financial responsibility. Again, it takes everything into account. There are multiple procedures, all the discounting rules, if it's a multi-tiered plan, if there's a primary and secondary insurance, there's nothing too complicated for our engine to figure out that patient's cost share. Authorization, we can help in a couple of ways. Typically, it's just that we're helping you track which cases need authorization and if there's one on file. If you're using United, Aetna, or Humana, or I should say if the patient has any of those 3 payers and it's been initiated by the physician office, then we can actually keep pinging the payer until they respond and provide us with that information. Electronic communication is a very effective means to get that estimate in front of the patient. 80% of patients are reachable by text, and average time to open is just under 3 minutes. So you can actually see patients as they open their estimates. It's a pretty cool phenomenon. And then, of course, patient collections, giving them the ability to pay directly from that estimate. We see more than 35% of patients, if there's a pay online button, we'll just go ahead and pay in full pre-service, and then offering other options like links out to Care Credit or maybe an internal payment plan, giving them the ability to connect telephonically with the center as well. And again, if a patient understands what it is they owe and why they owe it, they are much more prone to pay. And we make this a simple looking user interface and have great success collecting from the patient. And then lastly, I just want to highlight a success from one of our customers. I remember this was years ago, sitting down in the conference room, had the CEO of the office and the ASC, along with the folks who were in charge of his financial clearance process. And he said, hey guys, listen, we've identified that we have a problem. This seems like a very low risk way to solve that problem. All in favor, and everybody, kind of, I think, reluctantly raised their hand, but they did. And within a couple of months, we had really proven the efficacy of this platform. Today, they collect $1 million more pre-service than they ever had before. They've cut their third-party collections, their accounts that get sent to collections, more than in half. And they've just had a wonderful increase in efficiency. Whereas before they had multiple people in the department, now they have really just 2 who overlook the process. And it has been an incredible return on their investment. I tried to stay at 10 minutes. I think I got there, but I am going to turn this over to Chris Pompilio for an overview and our demo environment. And again, don't be shy about asking questions.
Awesome. Yeah, thanks, Chris. Great job on that. So let's give you a little proof of concept on everything that Chris was talking about. And let me share out my screen here in just one quick second. And it is that screen and share. Oh, actually, you know what? Sorry about that. Hang on. I'm sharing the wrong screen. Let me get back to.
I did tell everybody that you're an expert all things ASC, not all things Zoom.
Not all things Zoom, exactly. There we go. Do we see the clarity now on the screen? Okay. So actually a three-screen setup. So I'm kind of a nerd in that way, but not a Zoom expert on sharing that. So apologize for that. But let's jump right in here. I'll take a quick minute here to just orient everybody to the screen. First of all, HST Clarity is a browser-based user interface, browser-based system, so nothing to install locally. You can literally access it from pretty much anywhere you have internet access. For any IT folks on the call, you can limit that from certain devices if you want to, right? So always important to talk about that. But basically, when you log in, this would be the default or the home screen that you get to. By default, it's showing you a list of patients on the schedule. Nobody had to do anything to get these patients on the schedule. They're simply coming from the schedule in HST in here. So within minutes of that patient being scheduled, you're going to have that estimate there ready for you. The list itself, by default, it's a 2-week period looking forward in time, but you can change this to whatever time you want to in here. You can also filter what you want to see. Right now in my test database, I'm seeing all patients on my schedule. But if I just wanted to see ones that were verified or not verified or canceled cases for whatever reason, or ones that have a 0 estimate, you can filter those as well. And you can control the columns in here. I've set mine up the way I kind of like to work. We all like to have our own view of things. You can do the same thing, where you come in here and you can toggle off or on certain columns. If you want that patient's date of birth on there, or other ones, just tap that. It'll open it up, give you that one, and kind of change the way it looks there. And that's a user setting, right? However you set it up, that's exactly how you're going to see it and view that information. Just like any web page as well, there's a menu on the left-hand side here to go through some other details and reporting and admin functions. But we're going to stay at the high level on the basic functionality that Chris was talking about a little bit earlier. So when I'm looking at my patients in here, or my list of patients on the schedule going forward, a couple of things that I draw your attention to: the eligibility column, right? This is where the system has gone out and checked on that eligibility for the patient. As was mentioned, it's checking through several different avenues, several different sources, not just one source. We're getting that best information and bringing it back to you. And that is fully automated. And I know that word is thrown around a lot with software, but I truly do mean that. Nobody had to do anything except schedule this case with the patient's insurance information. Once that's done, as I said, within minutes, we've pulled in their eligibility and benefits and calculated out an estimate for them. If I were to click on one of these patients, and I'm going to pick on Jess here, and click on that eligibility, it shows me its active coverage. It shows me when the last time it was checked was in here too. And I'll tap on that one. It'll go ahead and open her up in here. Oh, hang on a second. It's going back to my other center. I have many centers set up in here as well. So let me make sure I'm in the right one that I'm looking at there. There we go. And now we'll go on Jess. Quick side note for those folks who work through more than one center, or maybe in a CBO, it is easy to go between centers right here at the top with that same login and get into that information in here. So close that. Let me go back to Jess again and click on that. Awesome. So this is what I would expect to see. It pops up with all the information coming in from that payer. And we highlight the specific fields for you that are probably most important, but everything in here is accessible to you. It is active coverage. There's no copayment on this one. There's a 20% co-insurance. The deductible remaining is in there, out-of-pocket max. You might see different information. Well, you will see different information here from different payers, but the format is fairly standard. So you can see all that information in here, and that's exactly what they're providing back to us. In this case of this patient, I know my partner in crime here, Chris, has scheduled the patient in here in the system using some of his information, but changed the name to protect the innocent, I guess, maybe the guilty for him. But if I click on the demographic conflict here, it's going to show me what that information I had in HST and what the payer has, and if that differs, and it'll highlight that for me. Now, each payer is a little different on what they may conflict on. So we display this to you here. By design, it doesn't automatically update it into HST because we want to make sure that, yes, you want to update that first. So you can do that manually if needed. And you actually see that back on the case list when you're in here. a little D button on here on some of these cases that indicates there's a demographic conflict on those cases. All right, so let's go and look at the estimate on this patient in here too. So when I click on the case, it'll take me over to Jess's case and show me that estimate. It shows me some information in here in red that it's been requested here. There's a non-covered implant. The patient's a minor. There's a few other alerts you can set up in the system as well. It's bringing in the CPT codes from how that case was scheduled. Those are coming in from HST Practice Management as well, or your practice system. You can update them here. Absolutely, you can change those. You can edit amounts in here if you need to. You shouldn't have to, right? We have a 98% accuracy rate on this information, so you can trust it when it comes in. But sometimes implants, for example, or a few other things might require some additional information, so you can click override and override the information in here. But it pulled in the deductible in there, pulled in the 20% co-insurance on these, the remaining out-of-pocket max, any co-insurance applied in here, and then a patient amount due on here, right? You can edit these fields as needed. It's pulling in that contract information in the system for that payer, Aetna in this case, and it has all that information in here for you. And then it can also be automated where this can send this information to the patient. It can send it via email or text or both. In this case, I just sent it earlier. It says the estimate was sent via email and text today, so I know that it's been sent in there. And when you do send it to the patient, they'll get a link in that message. No PHI in that message. Just simply tells them there's an estimate for their upcoming procedure. They click that link. They validate the patient by typing in the patient's birth date, and they'll see something that looks a lot like this. I'll go into my patient view here. We can brand it, of course, for your center. So it's always coming from you, not from HST. It's always gives the patient the information they need. Here's the estimate. You can define what shows up in here as far as the verbiage. The format's pretty standard, but the verbiage, so it makes sense to the patient. The procedures that we're doing here, the insurance allowed amount in this case. And then we break down their responsibility for them by copayment, deductible, co-insurance. We give them a little healthcare literacy here. If they're thinking, hey, wait a minute, I don't have a copayment. Right, you don't, that's zero, but you do have a co-insurance, right? And that's what that is, and it explains that to them a little bit as well. And then in my test database, I have it set up where I'm actually just wanting to collect upfront everything except the co-insurance. So kind of leaving that on there. It's up to you. Recommended, probably best practice is whatever they owe. That's what you want to collect from that patient. But if you want to do a percentage or a different calculation in there, you can absolutely do that. We can also do this with self-pay patients for that good faith estimate and provide that to them as well. And for them to pay. One of the biggest things, if we're all aware of today with that No Surprises Act and the good faith estimate, is you have to provide them with a lot of information, and you have to provide them with that information in their language. Well, we help take care of that too, because though you can just come up here, the patient can, and translate this into whatever their primary language is, and it will update that for them. So now here, that exact same estimate in Spanish, and all of the information is in that language as well. So easy to do that for the patient. And then down here where these little options are for the patient to click on, you can control those options as well, what appears to them and where they link to. So if it's a pay by phone, if you want that option, that would just let them know who to call at your office, when to call, the times, and we can take that payment right over the phone. Financial assistance and insurance info, we can link those to, financial assistance, maybe the care credit or smart card or something like that you may be using, or if there's an FAQ page on your website to give them information about that. You can also offer a payment plan in here if you wanted to as well. Pay it online. We can link that to whatever it might be that your online payment portal that you use today. In this case, if I click that, I've just linked it up to a patient notebook, and it fills out all that information for the patient and their account number and everything else, and the amount they're going to pay, and have their information in here so they can put that in as well. If you don't have a online payment portal today for the patient, or you're looking to change that one at some point, we can help with that as well. We do have what we call HST Pay, which will allow them to go ahead and make that payment as well. Right through here, the great thing about HST Pay is that's going to go ahead and automatically enter that payment right back in practice management on that patient visit. So again, saving time for the patient and equally importantly, the folks at the center, right, with what they're doing in here. You can customize the text in here. Like if you saw before, we typed a little information in there about the implant for that patient. You can have custom text for the individual payers in here that pop up and showing that information on there. So everybody knows exactly what they're going to owe. The other great thing about this, and I'll hit back a couple times and get back to the estimate we were looking at earlier. Cool. Is if I go back to my case list here as well, I would know if the patient has, if we've sent the estimate to the patient, if we haven't sent it yet for some reason, or if it's been viewed by the patient. So I can tell here this has been viewed by that patient. I just sent it out earlier. And when I tap on that, it's going to show me who created it. Chris Finelli created it. I actually emailed it out and texted it out. I put in my email and Chris's phone number there. So he viewed it for me. And if he chose any of those options, I see that date and time that he viewed it. So if this patient were to come in, right, maybe they're paying at the time of service. When they walk in, you can print this out for them too. It'll have the nice little printout similar to what we just saw on the estimate. And it'll have the last time they viewed it. So it's an easy conversation when Jess walks in. Hi, Jess, great to see you. Here's the estimate we sent you and you viewed on the 7th at 12 p.m. Right? We know all that stuff that's going on, and it can help to eliminate those awkward situations when they feign ignorance of not seeing that information. Quick little thing, I sent it to myself. When you do get it and they click it, they're going to get an email like this. You can kind of control the verbiage in here. And it's going to go ahead and give them a link to click on to view that estimate. And that's when they'll see that estimate right there for themselves when they're looking at the history there. A couple other things in here, and go back to my list in here as well. We talked about the demographic conflict and that information that's in there. The little P here for progressive estimation. What that is for is it can do a couple things. If they have visits scheduled in sequence, they have maybe a pain injection series or doing the cataract procedures where today I may be scheduling both visits for them, but they're several weeks apart. When it's calculating out the estimate for that second or third or subsequent visit, it's going to be able to do the math and assume that either all or some of that deductible has been met on the previous visit. So when the estimate is done for the second visit, it is calculated correctly. We can do that as well with the professional fees for the physician or anesthesia fees as well. So that can be displayed in one message to the patient with two links in there for them to be able to view and pay the professional fees as well. We know for those centers where it's the same physician office or one physician office and an ASC, the centers like to do that as well. And we can provide that to them when we're in here. And let's see, I was thinking about a couple other things. The pre-auth, Chris had mentioned that before. That is, we know, a tough nut to crack. It is for us as well. Payers don't make that readily available. Most payers don't in electronic discovery. And also, it is on the onus of the physician office, the primary care physician, to request that. To request that pre-auth. But you can track it in here. You can set it up so the payers default to pending here, or if it's not required. If you clicked on one of these, you can get that information in here on that one, and you can actually submit the inquiry right here too to that payer. We're ready for it when the payers make that readily available in a discoverable format. There's a few payers that do today. Chris mentioned a few of them, but you can definitely track it in here and have that information. I'm not going to go into too much detail on kind of the setup in here, but there are some reports you can run. There's an allowable lookup in here, which is great if you wanted to come in here and look up what that allowable is for certain procedures across multiple payers. You can do that as well and see that information. But the takeaway in here, and we're happy to, Lindsay will talk about it at the end of it. We're happy to go into detail if you want to with some of these centers, some of your centers, and see some specific information and details. But I did want to leave a little time at the end. Mr. Finelli, I'll defer back to you to see what I missed that's important in here. I think I did a fairly good job. And I don't know, Lindsay, you're monitoring the chat. If there are questions in the chat, happy to answer those as well.
I think that's pretty thorough. I'm impressed with your level of conciseness.
Tried, yeah, a little bit. Each time we do this, a little more concise. I have never been accused of not being verbose, as you might be able to tell. So keeping it simple
One
is
question for you. After you send the estimate, if a patient makes a partial payment, will that get updated automatically on future estimates?
yeah, great question. Yes. So if they've already received that and made a partial payment, if that's something you want to allow, they will see that in the estimate again to make the payment, the remainder of the payment. Or of course, if something changes. I know Chris mentioned before, I'll say it again, we're doing that eligibility check several times. So when the patient is scheduled, if they're scheduled, then into the next month, it's going to check it again at the change of month. It's going to check it again 2 days prior to the date of service. Super important. You're not getting dinged every time that you're checking that eligibility. And 100%, you can check that eligibility if you wanted to. On Jess, for example, maybe I'm talking to Jess and she goes, "Hey, I just paid $800, last week. So that deductible should have been met." Oh, all right. Well, let me check. It was checked, recently, but let me check again. I can always click that, or you can click that eligibility and just request. You can pull in any eligibility you want to. We default to 13 for the outpatient ambulatory services. But when you do hit that little request, it'll do it. And that's how long it takes. It's just going to pop that up there as I do it. And there's all that information. And well, you may have paid your, physician, but they haven't let the payer know yet. So that's why it's there. But you can change that if you want to and say, "Okay, I trust you. I know then we're going to change that and change the estimate for you there too."
Nice. Then one more with 1 minute left. Can you explain a little bit more how the anesthesia and professional fees work when calculating these estimates?
Yeah. So a couple quick things on that. You can actually set it up in a couple ways. Sometimes for the good faith estimate, it's not money you're collecting. It's going to be on the onus, obviously, of the provider for that, but you do want to include it on their estimate. So if you come in here and you can default this into that, it's going to default in, $500 for the anesthesia fee. And we know that the surgeon fee is going to be somewhere up there. I'll say $850 on this one and save that. That can show up on there we go. That can show up on that patient view in here. A little further, just informational for that patient. Let them know they're also going to be getting these, but it's not something we're collecting. It could also be set up where it is on a separate estimate with similar information that you can collect. And we keep that on a separate estimate because usually the money is going to a different place. So when they get that link and they get that email that you saw earlier and they click on it, one message, but when they click on this little estimate here, there'll be 2 places to view, and they'll see one that looks like this for the surgery center, and then one that looks very similar for the anesthesia or the surgeon, and see that information in there, and they can pay that separately. Hope that made sense.
Yeah. Thank you so much, Chris Manelli and Chris Pomp, for taking us into a deep dive into how our financial clearance tools work. As I mentioned at the beginning of the call, this is recorded. We will send this link out to everybody who joined us. And if you ever want to take a deep dive on how this could work for your center and maybe get a little bit more into the details of your specifics, reach out. Chris Manelli and Chris Pompilio are happy to do that for you. Thank you for joining us today.
Thank you all.